the neurologic condition called Huntington disease. But 200,000 Americans are said to be at risk. To explain why this is, we have Dr. Toni DeMarcaida, Medical Director of Hartford Healthcare's Chase Family Movement Disorder. Doctor, welcome back.
Thank you. It's good to see you again, Lisa.
Oh, good to see you. So first of all, what is Huntington disease?
Huntington disease is a neurologic condition that is caused by loss of brain cells in a part of the brain called the basal ganglia. What is challenging about Huntington disease is that the symptoms related to it is a triad that pretty much affects every aspect of people's lives. So there are the motor symptoms, involuntary movements like a fidgeting movement can also affect walking and balance. But in addition to that, it can affect their cognition. There's impairment of memory and thinking, and it has psychiatric manifestations as well, with depression, loss of motivation, even schizoaffective kinds of symptoms.
Oh, doctor, so why is it that there are only 30,000 Americans known to have this condition, that so many others are at risk for it?
It's about the genetics of it, Lisa. So Huntington disease is what we refer to as an autosomal dominant inherited disorder. So what that means is that for every patient who is diagnosed with Huntington disease, every child thereafter has a 50% risk of also developing this condition. So every one patient puts at risk every child that they have thereafter. So that's what's referred to by the at-risk people with Huntington.
Is there a cure for Huntington disease?
Unfortunately not, but we definitely have effective treatments. At the Chase Family Movement Disorder Center of Hartford Healthcare, what we emphasize is that in order to help these patients with all the symptoms that I described earlier, you really need a multidisciplinary approach. So we have the movement disorders neurologist to treat the involuntary movements. We have physical therapy and occupational therapy to help with everyday movement, everyday activities. We have the neuropsychiatrist to help with psychiatric symptoms, neuropsychologist, social worker, and wellness classes to keep them active and well. So it really takes this multidisciplinary approach in addition to some medications to treat the specific symptoms.
All right.
To keep that
Doctor,
person well.
We want to can you tell us in about 15 seconds about your symposium coming up?
Yes, I'd like everybody to join us on Saturday, learn more about Huntington disease. You can register at www.connecticut.htsa.org/edday, and this is a symposium to learn more about the condition for families and friends at Hartford Hospital's Education and Resource Center.
All right, Dr. Toni DeMarcaida, Medical Director with the Hartford Healthcare's Chase Family Movement Disorder Center. Thank you for joining us.
Thank you again.